high vaginal swab. This is a swab stick. A swab stick is used to collect samples in your vagina, especially if you're having discharges, recurrent infection. So we insert that into your vagina and then we swab. But for us to be able to correct a good quality sample, we need a speculum. A speculum helps us open your vagina, alright? So when you're able to open up your vagina, we see better. This test does not only collect the samples, we are able to see vividly the color of your discharge. So we open up your vagina like that and then we swab. As we swab, we're able to look, is your cervix swollen, the color of your discharge, the amount of discharge you are having. Right, so this is speculum. The process of collecting the sample is not painful, but it's a little bit uncomfortable. Now, after collecting the discharge, we want to check what it has. So you add normal saline. It's a drop of normal saline. That is a slide right there, and then the content that we have collected, we put it in this slide. The water is to help us observe better, right? So after you have collected the sample, you put it here. I'm trying to find a position here so that you're able to see better, right? I forgot my tripod stand at home. So after that, now this is me. You can see there's some yellowness at the tip of the swab. That's a clear indication that the patient has a yellow discharge. That is me discarding the content on the slide, right? Putting all the collected discharge. Okay, here, as I forgot to say that I collected more than 4 samples, because if the patient has had a recurrent yeast or a recurrent infection for that matter, we need to do things like culture. Now this is me here doing a wet prep. You see right there is some dirt. We want to see what is this dirt, right? The microscope can help us distinguish between the yeast, pus cells, trichomoniasis vaginalis. You can see, but let me zoom better for you to be able to see. These are pus cells. Pus cells are indication that you are having an infection. Could be bacteria, could be a viral infection. For us to be able to determine which one, we need to go further and do something like culture and sensitivity. Culture is growing the bacteria, sensitivity is subjecting the bacteria to drugs, determining the best drug for you. So if you've been having a recurrent infection, we could be able to do that. Culture does not entirely tell us maybe what you're suffering from is an STI. STIs, we don't do cultures to determine STIs. We do an STI profile. An STI profile contains gonorrhea, chlamydia, trichomonas, mycoplasma. That discharge can do that. But there is one STI we have left out. That is syphilis. Now for syphilis, we will require blood. We can do treponema pallidum hemagglutinin test to determine if you are having the syphilis, right? Could also do HIV. But for this matter, we recommend that these patients to do a STI profile at our lab is around 12,000. We do that at our clinic. So book your appointment if you have discharges and recurrent infection. You're much welcome.